My name is Ken Hekman. Welcome to this course called 4 Essential Disciplines, a training guide for healthcare leaders worldwide. My colleague, Quinton Friesen, and I are leading you through 15 modules to help you improve your knowledge, skills, and attitudes as a healthcare leader. This is Module 4 of 15. In this module, we will continue our review of the functions of leadership, looking at how leaders mobilize teams to accomplish organizational objectives. We have 3 learning objectives in this module. We will begin by looking at why teams are essential for healthcare organizations. We will talk about why it is difficult to work in teams and identify the 5 main functions of teams. We will explore how leaders can motivate people by aligning rewards with basic human needs.
Let's begin with a 2-part question. Why are teams so essential for organizations, and why are they so difficult to work with?
When I talk with leaders and managers, managing people frequently emerges as their most difficult function. Some will describe it as their number 1 management challenge, uniting diverse team members with different temperaments and motivations to work as one to achieve common goals. Yet, despite the difficulties, getting people to work in teams enables organizations to accomplish more than any one individual could accomplish on their own. When teams are organized and managed so that each person can build on their strengths and the individual strengths complement and balance each other, the team can become very efficient. Healthcare teams are unique when compared to other work teams in a couple of ways. Physicians, nurses, therapists, and administrative staff all have specialized knowledge and skills that take years to develop. But they are completely interdependent upon each other to serve patients and their communities. The complexity of healthcare teams is compounded by the fact that healthcare teams must serve multiple kinds of patients, each with their own diversified needs, and those patients expect to be served with consistent quality of care. On top of all that, the healthcare team must function in ways that are economically sustainable and constantly improving the quality of care.
It is clear that teams are vitally important in healthcare organizations. How can healthcare leaders build highly effective teams?
Patrick Lencioni is a leading author on the subject of teams. 2 of his books, The 5 Dysfunctions of a Team and The Advantage, outline principles for effective teams and the role leaders have in building effective teams. The first barrier for teams to overcome is the absence of trust. People need to trust each other before they can work together. The second challenge is fear of conflict. If team members are afraid to confront each other, they can't advance in their effectiveness. The next challenge is lack of commitment, in which team members prefer to protect themselves rather than commit to the good of the whole. Number 4 is avoidance of accountability. Team members who act independently without concern for the impact on others hinder the team's progress. Finally, there is the barrier of inattention to results. Everyone on the team needs to be focused on achieving a result, a common goal, for the team to be truly effective.
So, what is the role of the leader in building highly effective teams?
To build trust, the leader must go first by demonstrating trustworthy behavior and by being transparent and vulnerable with the team. To reduce the fear of conflict, the leader has to do more than simply try to avoid conflicts. Wise leaders search for potential conflicts and resolve them before they become a major problem. To build commitment, leaders need to make sure that decisions are clear and that everyone knows their role to achieve the next steps. Assuring accountability requires the leader to confront difficult issues. As a leader, sometimes you have to be direct in holding people to their commitments. If the team is to achieve results, the role of the leader is to continually maintain a focus on the collective outcomes, the common goals of the team and of the larger organization.
How do managers motivate people, especially when the manager has a highly diverse group of people to lead?
A good place to begin is to unite efforts around the common vision of the preferred future. Healthcare leaders and managers need to clearly articulate their vision for a better way of delivering healthcare services. They need to be consistent in their words and actions about that vision and be passionate about achieving the changes that may be necessary to fulfill the vision. Once the vision is clear, then leaders need to link goals with rewards so that each member on the team will be motivated to do their part to achieve the united vision. Human resources research tells us that managers and employees often have different ideas about what motivates people. Managers typically think that money is the top motivator, followed by job security and meaningful work. But when researchers ask employees what motivates them, the list is reversed. Meaningful work rises to the top, followed by job security, which includes respectful management, and then compensation and benefits. Actual human motivation, contrary to common management misperceptions, is more in line with psychologist Abraham Maslow's hierarchy of needs. Maslow recognized that people cannot achieve their full potential until more basic needs and psychological needs are met first. Their highest motivation is to achieve their full potential, which corresponds to meaningful work. But before they can fulfill that need, they need to feel esteem, respect, and the friendship that comes from being part of a team. Money is necessary to provide for the physiological and safety needs, but it is the most basic of motivators. Compensation and benefits need to be adequate to allow employees to aspire to meet their higher order needs. The lesson for healthcare leaders and managers should be clear. The best performing teams will be adequately compensated, respectfully supported, and encouraged to live to their fullest potential. These lessons apply at all levels in the healthcare organization, from the janitors to the nurses and physicians.
Let's look at some common questions about mobilizing and motivating people. How can managers change people's attitudes?
When people come into a new job, they take their core beliefs, values, and attitudes with them. But over time, managers can influence people's attitudes by creating a respectful and motivating workplace. They can build teams that trust each other, teams that learn to fight fair, to build commitment, accountability, and achieve results. When teams can celebrate their achievements, everyone's attitude changes for the better.
What can a manager do to unite highly independent physicians?
This may be the most important question a healthcare manager can ask. You can begin by casting a vision for high quality of care. Physicians are generally high achievers who hold themselves accountable to very high standards and resist being an outlier when it comes to the quality of care. Keep the vision for improving the quality of care in clear view and develop transparent reporting systems to support positive peer pressure and mutual physician accountability.
What do you do when rewards have no effect?
Take a closer look at what motivates people. Are the rewards aligned with the kind of behavior you are trying to achieve as a manager? Take time to get to know what motivates each member of your team. Then look for ways to be consistent and equitable in rewarding each person according to their motives and the team as a whole according to the achievement of your organizational goals.
This concludes Module 4 of 15 in the series on the 4 essential disciplines. We encourage you to discuss this module with others who are learning about leadership and management. Take some time to discuss this very simple case study. Imagine that your cardiologists don't get along with your cardiovascular surgeons. What can you do as a leader to mobilize and motivate them to collaborate? What risks might you find with each possible intervention?